Hey everybody, it's Craig, and today I am in beautiful Big Bear, California. We'll be at the VCA Lakeside Animal Hospital today, meeting with Dr. John DeLandtsheer and the rest of his crew. And today we're going to be talking about dental care and why it's important for your pets. So hopefully you will get out of this a greater appreciation for what goes into dental care and get a chance to meet some of the fine folks that make it happen every day there. So come along with me, we'll head on inside and get started. So Dr. DeLandtsheer, thanks for taking the time today to talk to us. We're looking forward to learning from you a little bit more about dental care in dogs and cats.
Sure. So when I think about dental care with our dogs and cats, or when clients do in general, at least in the human world, we think a lot about cavities. And cavities really, they're not an issue that we see with dogs and cats very often. The main type of dental issue that we get is periodontal disease, meaning infection and pathology of the gum line, and in particular the junction where the tooth and the gum line meet. And what happens is we'll get infection, we'll get inflammation, we'll get a lot of pain, and those things as a sequela to just having a lot of tartar buildup that of course allows bacteria to settle there, and it can lead to some pretty serious issues.
How often does this kind of thing happen? Is this all animals, and at what age?
We definitely see some species and breed differentials, but as a rule, if we look at the big picture, by 3 years old, we're looking at over 80% of dogs having significant periodontal disease, and 70% of cats having that same issue. And so what we like to do is at a year old is when we do our first dental exam. And during that dental exam, we're really going to be looking at the gum line. Of course, we're looking for tartar, but we're looking at gum health predominantly. Okay. And that's really the good starting point. Now, there are absolutely some animals that need no care at that time, other than maybe just prophylactic home care.
Okay, but like toothbrushing or chews.
Exactly.
Okay.
We have toothbrushing and enzymatic toothpaste that they have at the pet store that's perfect. They have certain dental chews and dental diets that also do a nice job, and sometimes that's enough. But we will also see a large number of dogs that already at a year of age, there's some significant changes, and we need to get in there, and the best thing that we can do is stop infection with antibiotics and get up there and prophylactically remove all the tartar, and scale up both below the gum line where we can see the tartar, but more importantly, up above the gum line where we can't see the tartar. And that's where the bacteria is really going to start digging in and getting a foothold, and that's where we'll have bone loss and abscesses and pain, which is really the main thing we're trying to avoid with our patients.
So other than when I come to see you for my annual exams, how can I tell at home if my dog has these stages of dental disease?
Sure. Well, a lot of times the first thing we see or experience is just a bad breath. Okay. And we could have bad breath and teeth that look to us pretty good until we start looking further. And that bad breath is really the first sign of that bacteria that's just normally part of the saliva in the dog's mouth getting a foothold and starting to lay down the tartar and cause the problems. But beyond that, when it's more severe, we might see things like swelling under the eyes indicative of an abscess, or we might notice that our patients or our pets are seeming like they're uncomfortable when they're eating, or they're losing weight. Things like that.
And so then understanding that these conditions are a natural part of an animal as they go through life, and they're going to need dental procedures at various times throughout their life stages, from middle age to senior animals. How do you approach anesthetic risk for these guys? I know people are concerned, will my animal be safe?
Well, and that's an absolutely perfect point. And one thing to touch on is, because of the way that we're cleaning these teeth and we're getting up under the gum line and we're having to be really thorough, these guys are under anesthesia.
Okay.
And because we're doing an anesthetic procedure, we take this very seriously. And so we are going to do a full exam workup before they go under anesthesia. We're looking for any sort of systemic problems. We're going to run blood work on them before they go under anesthesia,
Okay.
so we can catch things that are more subtle. Sometimes we'll catch something that we need to shift our priorities and maybe take care of that issue first.
Oh.
Sometimes it's merely now we know something's going on, and it's going to tweak our anesthetic approach, and it's going to let us know there's certain issues that we need to be prepared for ahead of time.
Okay. All right. So assuming you get through that process and we're advancing into the dental procedure itself, how about, after the procedure, if some teeth are taken, is it a painful experience? And,
It's not pleasant to have a tooth removed under any circumstances. We try to do a lot of things to mitigate any discomfort. We preload our patients with pain meds ahead of time in anticipation. We also will do a local anesthetic block, just like at your dentist, in anticipation of pain. And then post procedure, we will send patients home both on antibiotics and on pain meds, depending on what we have going on.
Okay. You mentioned, dental care that I received from myself. I know with my doctor, we take X-rays of my mouth. Is that something that you do here as well?
We do, and it's basically the same equipment, same situation, and we're looking for the same types of things.
Okay.
We're looking for teeth that maybe haven't erupted. We're looking for evidence of abscesses, evidence of bone loss in the jaw surrounding the roots. We're looking for broken teeth. So there are many things that we can see on an X-ray that we would never have a chance to figure out or diagnose without it.
If you were just looking at the mouth, you wouldn't see these things.
No.
Like the iceberg kind of effect.
Exactly.
Okay.
It's one thing to have a tooth that is loose and on its way to falling out. It's another to have a tooth that looks completely healthy, but we have a root that's abscessed.
Okay.
And an abscessed root, if any owners have ever experienced that, it is a very uncomfortable situation. And these guys can't tell us that that's what's going on. So that's where we definitely get benefits out of these diagnostics.
Well, I appreciate you taking this time, and I also appreciate, I understand you might have arranged for one of your employees to bring their animal in for us to observe a dental procedure on?
Yeah, we figured it'd be a good opportunity to just take our clients from start to finish through the process, so we can see what we do the day of, what we do prior to as far as the anesthetic blood work. Doing our physical exam, and then starting off the day and getting our pre-medications in, an IV catheter, and just everything from start to finish. So Lene has offered Abby to be the demonstration dog.
Okay.
She doesn't have a horrible mouth, but she does have some tartar. So we're not going to be seeing extractions or things like that, but we'll get a really good basic idea of the whole process and how everything goes.
Great. Well, then we'll meet you back here with Abby and Lene, and maybe we can just observe a little bit of your exam and join you for the day.
Perfect. Sounds like fun.
Thank you very much.
Take care.
Appreciate it.
Hey Craig, how you doing? This is Abby. This is Lene's dog. Lene is one of our technicians here at VCA. We're going to be doing a dental on Abby soon, and so we already have done our physical exam and everything, but we just wanted to kind of run through the process with you so you knew what we were doing for our pre-dental workup and exam. So basically, we're not just looking at teeth when it comes to these guys. We know we're going to have an anesthetic event, so what we want to look at is general appearance of our patient. We're going to go through and feel all of her lymph nodes through the body. We're going to listen to her heart and lungs. We're going to feel her abdomen, make sure we don't feel anything abnormal in GI or spleen or liver, for instance. And then once we're happy with everything there, we'll go through, and of course we're going to look at the teeth. And we look at their teeth in every exam, but pre-anesthetically, when we know we're doing a dental, we like to know what we're going to get into. So we like to look at just general occlusion of the jaw. We like to look at any alignment problems, any broken teeth. We certainly will go through and look at tartar accumulation, look at the gum line, see what kind of infection problems, any issues like that, just so we know best we can prior to the actual procedure what we're going to be getting into. Today, while Abby's here, we're going to be pulling our blood and urine and sending that to the lab. Make sure that's not going to be changing our anesthetic protocol at all.
Any x-rays?
On Abby, we're going to be taking some 5-view x-rays. We're going to take 3-view chest, 2-view abdomen. We don't do this on every procedure, but if we're dealing with an older patient and we have any concerns that we might have anything else systemically going on, we like to make sure lungs are clear, we don't see any issues with heart, we're not picking up any abnormalities with any organs that we wouldn't necessarily be able to feel during our exam.
So what's next for Abby then?
Well, she's ready. We're going to take her back and we're going to get our samples for the laboratory. We're going to pull some blood and some urine. Then we're going to take our x-rays, of course. And then Linnea going to take her home tonight and she's going to check in with reception on it. We're going to schedule the dental probably within the next few days to a week. And then we'll see Abby back for her dental.
Wonderful. Thanks, guys. Hey Wendy, how are you?
I'm good, thank you.
I'm good. Hey, so I was wondering if you could tell us a little bit about why dental care is important.
Well, by the age of 3, most dogs and cats have some form of periodontal disease, which can eventually lead to heart, liver, and kidney problems in the future.
So how can we tell if a middle-aged animal is in need of dental care?
Bad breath, you can flip the lip and see if there's any plaque or tartar on the teeth. They'll be pawing at their mouth.
Okay, great. Do you know
Some
anybody
examples.
around here that can teach us how to flip the lip?
I think Bri would be wonderful at showing us how to flip the lip.
Excellent idea. Thanks, Wendy.
Welcome. Bye.
Hi.
How are you?
Oh, I'm just great.
Hey, Wendy said that you might be able to show us what flip the lip is, how to do it, and maybe tell us a few things that we're looking for. But first you got to tell us who this is.
This is my dog, Duke.
Hi, Duke. So how do we do this, Bri?
So for flipping lip, you're literally just going to flip the lip.
Okay.
So you're going to grab the little corner and pull up, which will allow you to see all his teeth.
And what are we looking at here? We got the big ones in the front.
Those are the canines.
Okay.
Come here, boo-boo.
Where do you normally find dental disease if you're doing a little flip the lip?
Typically, you can see a little bit on the canines, that little yellow staining.
Okay.
But most importantly, you're going to see it on these back chewing teeth, which are known as the premolars.
Back in here is
Yeah,
where we're really peeking
that's where
around.
you're really going to see it. You can see a little bit of that redness by the gum line. That is as well a symptom of gum disease and some periodontal disease.
Okay.
It's been a hot minute since he's gotten a dental, but it looks like he's going to need to get one soon.
Cool. Well, we'll get you on the books. Thanks,
Oh,
Bri.
yeah.
Appreciate it.
Welcome.
Have a good day. So Dr. D, Abigale is just checking in at the front desk for her big dental procedure today, and I was wondering if you could tell us a little bit about, the things that your team will do to prepare Abby for her procedure this afternoon.
Well, the first thing we're going to do when Abby gets here is we're going to do an additional exam this morning, just to make sure nothing has changed since we've seen her last. Once that's done and we're comfortable with everything we're seeing, then within the anesthetic team will review her blood work and lab work and any concurrent issues that might be going on, and then we'll come up with an anesthetic plan. The anesthetic plan will consist of giving pre-anesthetic meds to calm them down and relax them so they're not nervous. Once those are done and given, we will place an IV catheter, start fluids preemptively before the dental, and let her get comfortable and situated.
So Randy, I hear you're the catheter king.
I am.
Hey Randy, I was hoping maybe you could tell us a little bit about the dental equipment that we use for our dental procedures.
Yeah, no problem. So what we have here is a mobile dental delivery system. So it's a really nice self-contained unit. So that makes it easy to transport it between treatment tables as we need it. And basically our first instrument that we have here is an ultrasonic scaler. So what it does is it has micro vibrations in the tip here, about 20 to 40,000 per minute. And that makes it nice because it's a nice pinpoint design that we can get exactly where we need to scale off the tartar and plaque off your crown surface. So what we'll do first is scale the teeth with this. And then we'll go on to polishing the tooth, which is where this comes in. So it's our rotating head polisher. So this rotates back and forth, and it's really nice because instead of one continuous round and around part, it doesn't get any hair or anything trapped in there from just rotating back and forth. So that's what we'll polish our crown surface with. If we do need to do any extractions or where we need to section a tooth, that's where our drill turbine comes into play. It's a really nice precision pinpoint design, very small head so we can get into very tight mouths as we see fit. So that's where our sectioning comes in. And then to round it up, what we have is just our basic air and water, just to clean out the mouth a bit better. If we need to see any parts that we extracted a bit better, we can blow air on that spot to see any specific problem areas. So that's basic our dental unit. We do have regulations to adjust pressure and the speed of our ultrasonic scaler as we see fit per patient.
Thank you, Andy. Appreciate it. So Dr. DeLandtsheer, talking with Randy today, he mentioned that for your patients going into anesthesia, sometimes you like to do some diagnostic testing ahead of time to make sure the animal is healthy. And I was wondering if you could tell us a little bit about that, the tests that you do, and what you learned from them.
Well, because we're putting these patients under anesthesia, we absolutely want to ensure that our organ function is okay. And we're not going to need to either do anesthesia differently because of those values or not do the procedure at all until we have certain medical conditions under control. In general, what we're checking is we want to check a CBC, which is going to be giving us our red count and white count, platelet count. It's going to let us know if we have any evidence of infection or sometimes even immune-mediated disease. Then beyond that, we're going to be looking at organ function. So that's where we're looking at the chemistry, looking at liver function, kidney function, electrolytes, things like that. And then finally, we're gonna run a urinalysis. And the urinalysis is certainly looking at the urine from the standpoint of any evidence of infection. But more importantly, it also gives us a little more focused idea and look into organ function, and that there are some parameters that we don't see on blood work as well, but when we see a hint on a urinalysis, it really gives us the full picture.
So Dr. DeLandtsheer, you mentioned that you were able to take some x-rays of Abigale before the procedure, so maybe you can give us a look at talk to us a little bit about your findings.
Sure. So these are normal x-rays that we're looking at, but this is Abby on her side, and we're looking at the lung field here, and we're looking at the vessels in the lung field. We're looking at the airways. This is the trachea coming in here and the carina, and then we're looking at the heart. This allows us to take measurements of the heart in certain situations. If I had a heart patient, I might want to take measurements on that heart and verify whether or not we had an enlarged heart or issues like that. So, and then this allows us to look at bones on one setting, and we can look for any evidence of arthritis, things that might be painful on a patient like this.
Do you ever find stuff in here that you didn't expect to see?
We very frequently find things that we're not looking for. Significant arthritis or well, for instance, we're looking at a spleen right here, and you can see how sharp and demarcated that is. Very easy for us to pick up a tumor on the spleen, which in a 7-year-old dog like Abby would be very common. Then we can go back and we're looking at intestines, we can look at pelvis. And we're going to flip back to the chest again just so we can look at another view, because we need multiple views. And so we're looking through rib structure, we're looking for heart size and general shape. We're also looking at our margins of the diaphragm and stomach and liver in this portion. Again, everything here looks good. Here's our little area of spleen, but that looks good, no evidence of any masses. All of the spine looks fine. We're going to go down into pelvis, and we're going to look at general hip issues. These hips look great, but we would be able to find things like hip dysplasia or back issues or even knee issues by these survey radiographs. And in Abby's case, all this looks great.
So Dr. DeLandtsheer, can you tell us a little bit about anesthesia and monitoring here today with our dental patient?
Sure. Since our patients are under full anesthesia, there are a lot of parameters that we need to really keep on top of to make sure that it's done as safely as possible. We've already induced them with specific anesthetic agents that are really designed for a short time period of anesthesia. And then afterwards, we're maintaining them on inhalant anesthesia. The things that we're monitoring are, of course, heart rate, respiratory rate, and blood pressure, but we're also measuring ventilation through CO2 monitoring, and we have an ECG running so we can make sure that the actual heart tracing is appropriate. Temperatures monitored continuously, as well as our oxygen saturation.
Is it typical that you'll have, two people working on a dental? What are their roles here?
So Lene is in charge of the dental cleaning herself, and so she's scaling and polishing and probing, and then and we'll also be in charge of taking the X-rays while the patient's under anesthesia. Randy's sole job here is running anesthesia, and so he's monitoring all those parameters.
So Randy, could you tell us a little bit about the, monitoring parameters, what's going on with anesthesia? I think that's usually one of the biggest concerns for people is, will my dog or my cat be safe today under anesthesia?
Yeah, no problem. So, I'm basically hooked up to our veterinary Cardell unit here. So with that monitor, it has a trace ECG wave of the heart. So we measure the actual heart waves that are going on. We have blood pressure as well, oxygen saturation, and your entitled CO2. So that's your carbon dioxide buildup the animal is breathing out. And we also have a separate pulse ox monitor for saturation and heart rate as well.
So is anesthesia, is it the same for every patient? Do you do the same thing each time?
Anesthesia is a very patient-specific type of procedure. So every dog, depending on their size and any concurrent medical issues, or just how they're doing under anesthesia, everything is very specialized and patient-specific.
So Lene, how did the dental procedure for Abigale go today?
Very, very well. Just pretty routine dental, everything cleaned up beautifully, as you can see.
No extractions?
No extractions. She has all of her original teeth.
Can you describe the dental anatomy for us here? What are we looking at?
So basically, up here are the incisors. These are all just those little guys. Canine, come back, we had some premolars, we get our molars, and then most people don't know there is a teeny tiny little guy back here that is very hard to see. So we always make sure, check these guys back there. It's one of the great things about being under anesthesia is we have that accessibility.
Where do you find most of the problems?
A lot of times you're looking at this big guy right here, this carnasial tooth. Sometimes you'll have them where they're slab fractured, so part of the tooth is off, or they abscess up in that root. You can see hers doesn't really probe, which is exactly what we want.
Meaning that probe,
Sometimes,
it could go underneath the gum line right there?
Yeah, occasionally we'll go to do this and it'll slip all the way up in here, and that's just not something we really like to see.
When you're cleaning the teeth with that ultrasonic scaler that Randy was showing us, do you go underneath that gum line area?
We do. We take it just along the gum line here, just underneath, making sure we get everything out that you can't really see. Helps that gum line adhere back to the tooth nicely once it's all freshened up.
How about record keeping? Do you guys keep track of different pockets that you find, depths that you notate?
Yeah, so basically what I'll do with my helper is I'll kind of go through and I'll run this along the edge of the gum line here, and I'll spout off some numbers to him and say, 104, got depth at 2, so forth. This is our anesthesia or our dental charting sheet. So he'll go through and he'll put our pockets and everything on there that we found. If there's an extraction, he'll mark that on there, any missing teeth. So pretty cool stuff.
Thanks, Lene.
You're welcome.
So Dr. DeLandtsheer, can you tell us a little bit about the dental radiographs? I understand you take those on most patients when you can, and can you tell us a little bit about how that works, what you use them for, things that you find?
Sure. So we have a digital dental X-ray machine, which is much like our normal X-ray machine, just able to focus a finer beam. And what we're looking for is we're looking at just general tooth health that's beyond what we can actually see or probe. So we're able to look at the roots of the teeth. We're able to look at any evidence of bone loss or problems with the jaw itself. We can see things like fractures in a tooth that we wouldn't be able to find any other way until it abscessed. We can also look at progression of disease over time, and we can see if we're losing bone or if we're having root resorption or problems like that, and then we can address that more effectively.
I'm here today with MT and Kayla from VCA's reception team, and ladies, I'm trying to help folks understand how to solve the problem of financing these dental care services, which, depending on what's going on, if you have advanced care needs, they can get quite costly. And so I figured that's something that you both encounter on a regular basis, and was hoping you could share some of the common solutions that you have for your clients.
Yes, we have two great options. One is Care Credit, the other is Care Club. I'll be discussing Care Credit, and Kayla will go over Care Club.
Perfect.
Care Credit is a veterinary medical credit card that can be either applied for online or at our facility. They offer no interest plans.
For unlimited amount of time, or?
Anything over $200 offers 6 months no interest. Anything over $1,000 offers 12 months no interest.
Wow.
And with the price that dental care can run, it becomes very affordable monthly payments.
So Kayla, what can you tell us about Care Club?
Care Club is a program that we have here that you can sign up for your pet. We have them for all ages of pets, from puppies and kittens to adult pets and to senior pets. We have the regular Care Club, or you can sign up for Care Club Plus. Care Club Plus for adults and for senior pets. We have the dental care, it comes in that.
Is everything in that included, regarding the dental? Like, what if they need to take x-rays of the mouth?
They are still, that is covered also in Care Club.
Okay.
So it's any lab work and any dental x-rays. And
okay.
The dental cleaning is under that as well.
Do I have to pay for that whole program up front, or how does that part of it work?
No, you just pay for the enrollment fee, and then anything after that is going to be separated into monthly payments for a whole year.
Okay, perfect. Do you like it? Is it a good plan? I mean, do people seem to like it?
Yeah, a lot of people seem to like it. It's very convenient, especially when you have to come in for an exam. You don't have to pay for it because you're spanning it out for a monthly payment, so that is covered under your care plan.
That does sound nice. Great. All right, well, that's perfect. Well, I appreciate your time and your conversation, Kayla. We'll let you get back to it. I'm sure you're busy as normal here. Thank you. Have a good day. Bye. Randy, we've finished the dental procedure, and what phase are we in now?
Well, we're in the recovery phase now. So the main thing we want to do is make sure that our patient's going to wake up nice and easy, a nice padded surface, no stressful stimulus, loud noises around them. Also, we have them on a thermal source too. Try to monitor, make sure their temp gets back to normal.
How will you know when recovery is completed?
Generally, when they're consciously bright and alert, responsive, standing on their feet. That's the main thing we're looking for. We're also checking them every 5 minutes. Same thing, monitoring her vitals like we were doing before while she was under.
Wonderful. And we expect Abby to make a full recovery.
Yep, she's a good patient.
Well, thanks for letting us have a real close look at her procedure today, Lene. We know we put a little extra stress on you, but we really appreciate it for the benefit of everybody out there. So thanks a lot.
You're welcome.
All right, have a good day. Easiest visit ever. Well, folks, that pretty much does it for us. We'd like to give a huge thank you to all of our amazing staff for all their effort and hard work. We'd especially like to thank Lene and Abby for their unique participation. We hope you've enjoyed our little presentation, and we hope you've learned something today too. Dental disease is a sneaky little problem that can create big troubles when undetected. So don't forget to flip the lip today and be sure to let us know if you have any questions. From all of us here at VCA Lakeside, we'd like to thank you for your support and your trust. And we hope you have a good day. Bye-bye.